What's up, y'all? It's your boy B Hall back at you again with another video. Another video. As y'all can see, I don't have the hood on my head, but I am kind of looking this way a little bit. But the reason being for my absence from YouTube and is because way before I had not way before, but like in 2020 when I started my YouTube before I started my YouTube journey, I had been diagnosed with this disease. And the disease is called Moya Moya. As it says here, Moya Moya is a rare vascular disease of the brain in which the main arteries that supply the blood to your brain become narrowed or blocked. In Moya Moya disease, the carotid arteries, whatever that is, narrow over time. So what that means is like right here is when I had my first surgery, which was June 4th, 2020. So I don't know if you can guys can really see the scar or whatever, because I do have hair and stuff, but it's a scar right there, and the scar goes from here down to like right here. So it's basically that scar. And then so so with that, and then for on the which would be my left side. So on the left side, that would have messed up my motor skills and my talking and and being able to do basic things. So thank God none of that happened. It's just that, my head was a little swollen and I had a nice scar. The downside of that operation was that I was like when I woke up, I was throwing up for like a day and a half before I could actually hold down actual food. I just kept throwing up, throwing up. So fast forwarded to February 2024. I had to have it done again, but I had to have it done on my left side. So if you see, you can kind of see the scarring from the surgery. So So you see that? Yeah, that's the scarring from the surgery. It's still healing right now. So I've only been out of the hospital for 6 days. But going back to 2020, I was in the hospital for 4 days. This time I was in the hospital for 36 hours. So I didn't throw up or none of that stuff when it came, like when I came out of the operation and all that stuff. I came out, went straight to my to the ICU room. So they, what I'm saying, then they took me to get my what's it called, a ultrasound of my head. So I guess everything came back, pleasantly, good. So so in about, 36 hours I was coming home. So that was like Friday around like 12:30, last Friday, which would be February 9th. So I was able to watch the Super Bowl at my house. Go Chiefs. Uh So, so with all this being said, as you can see, like when I first came home, it was like my head was little out here. My eye was like kind of like black and closing a little bit, but they say everything was cool. So I looked on my phone, I looked at my picture, I was like, man, my eye is kind of black. So I came home, did did my little home remedies, saying putting, you know, shea butter and stuff on my eye and all on my, saying on my scar and all that stuff. It starts healing. So I'm feeling like even good. Like even after the surgery, I felt like good. The next day, Friday morning, felt real good. I'm just like, it's like, Mr. Hall, you want to go home? It's like, yes, I do. It's like, all right, they say, answer these questions and all that stuff. So I guess I got two into the answers. They're like, okay, okay. Oh, yeah, you really can go home. Like, it's no need for you to stay. So I got up and you know what I'm saying? I walked around the room and had to do all that, had to, move, do a little bowel movement. So once I was able to, what I'm saying, move my bowels, that's all right, you can go home. So yeah, we're gonna release you around like 12 o'clock. My wife was there to get me at 12:30. But all that being said, this is the reason why I took this long break from YouTube was because I didn't want to go through this again. I already went through it once. And then trying to go through it again, and it's always a chance of death. It's always a risk of death in whatever surgery it is. It's always a risk of death. So I was thinking of that. I was thinking of my, saying my wife, my children, my mother, my father, my brothers, my sister, saying my grandparents, my cousins, their significant others, my aunties, my uncles, like all that weighed in on me. And it's weighing in on me because I'm the oldest on both sides of my family. I'm the oldest grandchild. So how'd that look, saying, after all the stuff I done did with my life, then, saying, it's a possibility that, it could all end from a surgery that I didn't have no control over. And the surgery and the disease comes from is basically in Oriental, Japanese, Chinese type Koreans and all that. It's like in the Oriental disease. And I'm like, well, how did I get that? As you can see, I'm African American, you know? That's like, I don't know. That's like, but you always had the disease. It just when it came out, it came out. So, and but in the midst of all of that, I'm happy that I'm able to make this video, to speak to you all. But I wouldn't wish this disease on nobody, nobody at all. I wouldn't wish no disease on nobody. But me having to live through this, what I'm saying, and and just continually just progress through life with this, what I'm saying, I'm taking every bit of precaution there is, like, to secure my life. You know what I'm saying? This disease and this surgery was a preventative surgery to prevent me from having a stroke within maybe next year, later this year. You know what I'm saying? Maybe if I wouldn't have got it done, I might have a stroke tomorrow or later on today. But this stroke is, I mean, this surgery was to prevent a stroke from happening for like at least 20 to 30 years. So 20 to 30 years, and if I do, like I said, what I'm doing as of now, what I'm saying, to keep myself healthy and on a right path, and have a great bill of health, then I should be cool. You know what I'm saying? I'm trying to live till I'm 90, to be honest with you. I'm trying to live till at least I'm 90, 95, something like that. 'Cause I want to get all that I can out of life, all that I can out of my children, all that I can out of my wife. You know what I'm saying? I want to get it all, you know what I'm saying? Because you never know. You might be here tomorrow. I mean, you here today, but you might be gone tomorrow. So you just gotta live life like, you know what I'm saying? Like that's, what I'm saying? You just gotta live your life. Live your life. And then, you know, and then when it comes down, what I'm saying? And I'm I'm happy. I'm happy that the surgery is over with. I'm very happy with that the surgery is over with. But anyway, I got some papers on Moya Moya. So it says like right here. Hold on. Okay, so it says right here. Okay, anyway, it says right here, Moya Moya disease is a rare blood vessel disorder in which the artery in the skull becomes blocked and narrowed, reducing blood flow to your brain. Tiny blood vessels then open up at the base of the brain to attempt to supply the brain with blood. The condition may cause a mini stroke, which I had in 2020, or bleeding in the brain, which I didn't have. It can also affect how well your brain functions and cause cognitive and development delays or disability, which I didn't have. I don't have. I don't have. Moya Moya disease most commonly affects children, but adults may have the disease. Moya Moya disease is found all over the world, but is most common in East Asia countries, especially Korea, Japan, and China. This may possibly due to certain genetic factors in the population. So it's like, why did I get it? I know I wear a lot of bathing ape. No, it's playing. But the symptoms may occur at any age. Those symptoms mostly occur between 5 and 10 years of age in children and between 30 and 50 in adults. The first symptom of Moya Moya disease is usually a stroke or recurrent transient and ischemic attack, a TIA, especially in children. Adults also may experience these symptoms, but also experience bleeding in the brain, which is a hemorrhagic stroke from abnormal brain vessels. Yeah. So it says, what I'm saying, the signs and symptoms that would occur would be headache, seizures, weakness, numbness, paralysis in your face, arm, leg, or typically one side of your body. But to be honest, when I had my first one, my because it was on my left side, my right leg went like numb. I kept tripping over it. So then it says also the difficulty speaking or understanding others, which I didn't have, developmental delays, which I didn't have, or involuntary movements, which I didn't have. Okay. It says the causes they may be unknown. So the causes may be unknown. Moya Moya disease is more commonly seen in Japan, Korea, and China, but it also occurs in parts of the world. So I don't know. Then it says the risk factors are of having it may be including being of Asian descent, not of Asian descent. Having a family history of Moya Moya disease. Nobody in my family has it except for me. Having certain medical conditions. So what would that be? Sickle cell disease or Down syndrome? I don't have those. Being a female? Obviously, I'm not a female. Being young? Obviously, I'm not young. I'm young. I'm young at heart, but I'm not young. Well, young, they mean like 15 years or younger. You know? But I just wanted to give y'all a little background of why I haven't been on YouTube like that, and that's pretty much it. It took a lot for me to make this video to open up my personal life to you guys. So hope you guys appreciate it. Remember to like, share, subscribe, and let's get it.